Okay, hi Dusty, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment now, and there's a little something on our scope, so we're going to clean that off. We'll show you some more in just a minute. Okay, so now we have a nice clear picture for you. We're going to put in our shaver. This has suction attached to it, and the inner tube spins around so we can debride some of the things we see. You can see some of the cartilage that's loose here on the femoral condyle on the inside part of the knee. You can see here you've got meniscus tear and you've got some areas of exposed cartilage down below. Kind of the yellowish area is where the bone is exposed, kind of on the far medial side of the compartment. And so far we haven't seen anything that can get caught in the joint, which is good. We'll come in here to the middle part of the knee. And here's one of the things we were concerned about. See that right there? And so we're going to remove that. That doesn't really serve any purpose other than to potentially bother you. And you can see how quickly we can remove it. Now it's gone. That can't get pinched here. Here's the ACL graft. Okay, so we're going to go off on the video for a minute. Okay, so this is the lateral side of the knee, and again, the most remarkable thing is the arthritis and the loss of cartilage. We're going to clean up the meniscus tears here. And I think what you'll find is we look at the plateau, you can see lots of areas of exposed bone. Again, the yellowish areas where the bone is exposed. We're going to take a pair of basket forceps here and just trim a little bit of this lateral meniscus. It's already obviously been trimmed before, but there's an area in here that I'm worried if I leave it, it's going to tear more. Okay. We'll show you some more in a little bit. Okay, so we're done with the lateral compartment. You can see the areas on the tibial plateau that are pretty beat up there with arthritis, and now we've got at least you've got the meniscus stabilized. I don't see much else to do here. We can look at the femoral condyle, and it's a little bit irregular and not smooth anymore either. But again, that's just the nature of this process. We're going to look at the patellofemoral joint next. We'll show you that in a minute. Okay, so here's the other little thing we saw in the MRI scan. See that right there? We're going to go ahead and remove that. And so as you look at the rest of this medial gutter, I don't see anything else in here loose. We'll pull back. There's the patella at the top of the screen, and as expected, it's got a lot of arthritis, a lot of softening of the cartilage here. We'll look at the trochlea, which is this groove that the patella glides in. We just follow this down here, down to the front, and that actually looks pretty good. Back over to the medial gutter, make sure there's nothing else here. I think everything else we're seeing is either bone spur or just the joint capsule. Okay. All right, we'll show you some more in a little bit. Okay, we are just removing this last piece here. You can see we've got our jaws clamped around it. Let me pull back a little bit. This right below it is a bone spur, but this is that last loose piece, and we're going to pull this out right through here, and now it's gone and no longer in the knee. So we're going to finish up here and get you back to the recovery room shortly. We're going to do our injection, of course, also. But hopefully this really does the trick for you, okay? Good luck to you now. Bye-bye.